Yes, hi, I'm Lance Laird, and I'm at the BU School of Medicine. I help direct the medical anthropology master's program there. My doctoral studies were actually in theology and comparative religion, with a specialization in Islamic studies and interfaith relations. And I came to medical anthropology through a research project on Muslims and healing in Boston back in 2004. I've been studying intersections of Muslims, other religious and racialized communities, and healthcare since then. And I've been experimenting with this idea that religion can often, but not always, be a health asset or a determinant of health for the public. So if you could switch to the slide. As many of you may know, Muslim communities in the United States constitute one of the most ethnically diverse religious communities, with large African American, South Asian, and Arab populations, as well as European, African, and Latinx members who identify as Muslim. In the past 20 years, immigrants and refugees from Bosnia, Somalia, Nigeria, Turkey, Iraq, and Syria have settled in Boston, joining Muslim communities tracing their history to the late 19th century shipyard. About a decade ago, my Brandeis colleague Wendy Cadge and I began studying the emergence of Muslim charitable clinics in the United States. These often emerged from physicians gathered at mosques or at universities who saw health disparities in their own immigrant communities or among their neighbors and pooled resources to act out their faith in service. In 2018, a filmmaker, Matt Colacello here, who did the film Unconditional Care, commissioned an updated study, and Nabil Khan and I documented the growth from about 25 Muslim clinics in 2010 to over 70 free clinics in 2018. And this past year, the American Muslim Health Professionals Association collaborated with us and a colleague at University of Texas to study shifts in this movement through a national survey coupled with ethnographic work in Central Florida and Houston. Next slide. The second project I've been involved with recently focuses on the experiences of a cohort of Muslim healthcare chaplains. African American Muslims pioneered entry into this largely white Protestant-dominated field, and many first and second generation immigrant Muslims continue to study and be translated into liberal Protestant modes of religion and spirituality. This form of integrated healthcare for the whole person is now being exported to Muslim majority countries' healthcare institutions. Next slide. As the COVID vaccines continue to roll out, we've seen patterns of access inequities among a number of immigrant communities in Greater Boston. The Center to Support Immigrant Organizing has been hosting discussions between immigrant faith and labor groups and city, hospital, and health center officials, including Sarah Kimball, to find ways to build trustworthiness of institutions and to identify key concerns about equity. We're seeking to identify best practices and partners who can help to build trust. Next slide. And finally, with the rapid transition to telehealth, we're examining how infrastructural, linguistic, and racial inequities affect different populations of patients seen at Boston Medical Center and several Boston neighborhood clinics. And this is with support from the BU Center for Anti-Racist Research.